Hey, I'm Luke Schellenberger. I'm an ENT doc. So I'm also actually board certified in sleep medicine. And so patients come in pretty frequently. They've been referred by other doctors. They have known sleep apnea, and they come in and see me because they can't tolerate their CPAP. CPAP is a very good treatment for sleep apnea. It is by far our kind of go-to, our what's called the standard therapy when patients have moderate or severe sleep apnea. But it's not for everyone. Research has showed us that about a third of patients just cannot tolerate it. They come in and say, I don't care what this thing says it can do, I can't keep it on my face. And so, well, that's when they come and see me, because I'm a surgeon and I can operate on the airway and do different things. So traditional sleep apnea surgeries are basically based on the idea of we're going to move a structure and we hope that it stays there. And traditionally there's been two major problems with traditional sleep apnea surgery. So, and one is the research really shows that they don't work nearly as well as we would like them to work. We'd like them to work, 90% of the time, where patients no longer have sleep apnea. That's really just not very realistic. Moving those structures around and hoping that'll stay there, really success rates are maybe around 50 or 70%. And that's not a curing sleep apnea, that's improving it significantly. So if somebody comes in and they've got a sleep apnea score that's really bad, like at 70 or 80 or 90, and they can't tolerate CPAP, they really must get something done, because if left untreated, the sleep apnea will cause a lot of problems with their heart and lungs and increased risk of strokes and heart attacks and things like that. And so we have to do something. Well, and that when they can't tolerate CPAP, what was typically all that was left for them to do were these traditional sleep apnea surgeries. But if we got those scores from, like, say, example for a sleep apnea score of 80, when normal is less than 5, down to 40, that's a huge improvement. We'd say, hey, that's so much better. But still, success rates were only around 50 to 70%. And that, combined with the second problem, is that those traditional sleep surgeries had a really tough recovery. When we're moving structures around in the throat, trying to kind of reposition them and suture them and open things up, man, it's like a bomb goes off in your throat. And so you're there, and you have a really tough recovery for a week or 2 weeks or even 2.5 weeks or 3 weeks. And so it's not to say that those other surgeries don't have a role, but you have to kind of go into them with eyes wide open, saying, okay, what do I really have to do this? And these are still surgeries that I do, moving the palate around. And I'm going to talk more about those surgeries, more specific in other videos and maybe a written out blog post. But patients have always kind of struggled with, I don't like my CPAP, or I won't use it, and my other option is this challenging surgery. Now, a lot of patients say, look, that's what I'm going to do, and so they're ready for that. But I'm going to talk about in another post, there is a new treatment that has come around called Inspire, or a hypoglossal nerve stimulator, that really, I think and fully believe that over the next 10 years, and has already in the last 10 years, already changed the way that we can manage sleep apnea surgically, and I think probably is really the surgeries like it are the wave of the future. And I'm going to talk about that one in another video.